first I'd like to thank everybody for coming out, and what we have here presented by the Johnston Society is some students that are returning to give us, the first years, some beneficial information and words of wisdom, and we can't thank them enough. So if I could have you guys introduce yourselves, and then we'll get to some questions.
I'm Meghan Cooper. I'm going for urology.
I'm Arianna Gianakos, and I'll be doing orthopedic surgery.
Zachary Griggs. I'm going for otolaryngology and facial plastic surgery.
And I'm Keith Volner, going for ENT in the military match.
Excellent. So we have some very qualified students here, and hopefully we can get a lot of excellent information out of them. So, first question. What are some pointers to standing out during rotations?
I think the biggest thing is you want to make the residents' life easier. So anything you can do to make their life easier is going to look really good on you, and they're going to tell their attendings. They do have a say in a lot of people who interview and match, so doing anything you can to help them is great.
Awesome.
Okay. Just to add with that, some more specific things even too, I think is you want to see what the physicians are doing on their daily activities and what you can do to make their lives easier. And this is just a small one. I'm only mentioning this just because an attending mentioned to me, but for ENT specifically, is when they're going to suction out patients' ears in the outpatient office, he would always grab some water and be turning around, so then I started grabbing the water and holding it there for him. And he mentioned that to me. He's like, that's something that you can do. So really kind of try to be aware of your surroundings and any little thing you can do to help out. If it's prepping the patient in the OR, if they prep them a certain way, or they put towels under their shoulders, or wherever you can, notice those things and try to do it.
And one last thing to add with him, which one of the residents told me, was always have on a surgical rotation, you want to put in your pockets gauze, suture, both removal kits and staple removal kits also. That's something I didn't know right away on my first surgery rotation, which I wish someone would tell me, because when residents who you're not normally working with see that you have them, you easily just hand it to them, and that's already an easy thing to do. That's just like a little thing.
And tape is another thing to have in your pocket.
Tape, scissors. If you're on trauma, you can have a pair of trauma shears, try to find one, and then you can kind of make some things your responsibility. For example, I made myself, my responsibility was to get the patient exposed. So I was in charge, anytime a trauma came in, I was the one that would cut off their clothes and make sure we get full exposure to the patient.
This is all golden information. I love this. All right, next question. How are we going to best prepare ourselves for our rotations? Is there any specific books, information, website, anything that'll just give us anything to prepare ourselves?
Personally, I liked case files for each core rotation. They have one for each of the cores. They have cases that start off each part of the book, and then you have questions at the end of each chapter, which is nice. Sometimes people use the book blueprints. That's another one that gives you pretty much a synopsis of each individual rotation. So I actually like to skim through that first, look at some cases beforehand so that I could go to the rotation with some background knowledge on that rotation. They don't expect you to know all that much the first couple of days, just some basic information about whatever topic you're going to be covering. In addition to that, definitely do UWorld questions every day if you can, just because that'll help you just get in gear for what they're going to be asking you. We could actually make a list for you too of the different books that we liked. I think that would be very helpful to have. Some of our students, we actually would submit them to each other, and when say I took a psych rotation first and he took surgery first, I would say I used this book and they were very helpful, and he would do the same for me. So I think that was helpful in that pairing.
Yeah, I would agree with that too. Because LECOM, we take the MBME shelf exams, definitely purchasing UWorld for the entire year and using that subject specific is going to help, because it's the most accurate to what you're going to have on a shelf exam. Same books that you talked about. As far as specialty specific for whatever specialty you want to pursue, talk to the residents, look on forums and see what are the big books that they use in the specialty. Is there a pocket book that every resident is going to have in their white coat as they're doing rounds, or what's the big book that they all read from that's their Bible for whatever that one may be, and just try to be familiar with that. And then when you go on these elective rotations, even if it's not with a residency, but you may think you want to ask that attending for a letter of recommendation at a later time, show them that you're reading, ask questions, and engage them.
And you'll be able to find students that have done the same rotation as well, and ask them, oh, what kind of questions did they ask? What kind of things do I need to study? And as far as preparing for the rotations themselves, definitely for surgery rotations, it's a good idea to start practicing suturing early or at any time, really. Practice suturing and tying knots. You can go on YouTube how to tie knots, and you can practice that early. And if you're confident to start doing suturing, if you're in the OR, like someone will be able to like pick up that you're able to close and being confident at it, and then they'll let you do more. So.
And the other thing I would just add on real quick is for urology specifically, know how to put in a Foley catheter and try and get out on the floor, ask the nurses anytime you need a Foley, ask me, I can do it. And for urology specifically, the Pocket Guide to Urology by Jeff Leader is a great book.
And Pastano Surgery, that's the Kaplan book. Did you all use that too?
Yeah.
Pastano Notes, is that the name of the book?
Yeah, Johnston Surgery.
Yeah, that's one that every surgical rotation you want to have just in your pocket. It's just a list of basic facts that were really helpful.
Spell that title, or say it more clearly.
Carlos Pestana, Pestana, I believe. Carlos Pestana Surgery Notes.
Cheap book.
You can Google it.
Yeah, you just Google it. Amazon has it. Very easy, but you want it for surgery.
I think the notes are actually online too.
Yeah.
There's notes online.
I believe the school offers something called USMLE Weapon. Are you guys familiar with that, and how good of a reference, a resource is that? In the same vein as what you guys had mentioned earlier.
I don't think USMLE Weapon was available for step 2
No, just
through the school. So
They had a test weapon for step 1, which was a combination of ComBank and like their USMLE style questions. It's called test weapons. But USMLE World is by far like the kind of standard to go through, because that's from the NBME, the people that write for USMLE. So
Gotcha. Okay, change gears. What are some major no-nos to do on your rotations?
no notes. Okay. I'll put it on too long a list. So you want to seem like you're eager to learn, obviously, and make sure you are eager to learn. But at the same time, you don't want to be distracting or taking away from what the surgeon's doing. So if you're in the OR and you're scrubbed in, don't necessarily try to show off any little facts that you have. I mean, you can ask questions, be inquisitive. A great trick is if you read about the surgery, and this is key, I think, for all of us, is you want to read about the surgery at least a day or a few days before you actually go in and do it, so you know what's going on. You'll get an idea of what they're going to ask you about, and maybe they use a different technique. You can say, oh, I saw something about this technique. Why do you do it this way instead? And I think it's kind of a little bit of a slick way to say, hey, I'm reading for this. I know what's going on. I'm interested. I'm engaged with it.
the flip side of that is don't ask questions that you're not prepared to answer pimp questions to. So don't ask questions about X disease and not be able to answer the follow-up questions that they're going to have for you, because they'll know that you weren't reading and that you're just asking questions.
What about something that's not so obvious? Like, obviously you're going to try to act your best around the doctor, but what are little things that maybe can hurt you instead of help you?
One thing I was told by a resident that I thought was really good to know, when they ask you questions, either the residents or the attendings, don't guess. If you don't know the answer, just say you don't know the answer, and you'll look it up and come back to them tomorrow. Because when you look like you're guessing or you're not confident in your answer, that looks worse on you than just saying, I don't know the answer, I'll look it up.
And follow up with it too when you do look it
Yeah,
up to talk to
definitely.
them.
Mm-hmm.
Absolutely, absolutely.
Excellent. Okay, so talking about rotations in your preferred specialty, when is it best to go to do those rotations? First, last, middle?
I think it depends if you know for sure what you want to go into. So if you're 100% sure that you want to do orthopedics or ENT, you want to set them up sooner than later. Get as much exposure and experience as possible early on, because the more experience you have, then down the road, you're just going to start looking better and better and better. For me, I wasn't 100% sure what I wanted to go into, so I used one elective to do an orthopedic research elective, which I ended up enjoying. Then I did an orthopedic surgery rotation and ended up enjoying it. And I did that probably within the first 4 months of the third year. So my best advice is to figure out as soon as possible what you want, because surgery is very competitive, especially some of the subspecialties. So you want to do anything that's going to get you ahead. So #1, if you could do some research, I highly recommend doing that. If you have questions on that, I can help with that. Number two, if you can set up your rotations, if you're going to do an osteopathic program in particular, set it up at places that have residency programs. Start getting yourself in with the residents, because the residents have a huge part and role in who gets accepted. If they like you, that's a huge plus, and you can actually get someone to write a recommendation letter. I had one, I thought I might do general surgery and go into plastics at one point, and I became really close with the head chief resident there at the one program, and he was able to get me connected with the program director. I mean, unfortunately, I'm not going that way, but, you know, it's something that people need to like you, and they want to work with people that they like, so you have to really show a good personality, and, yeah.
To answer the question very directly, like when should you schedule the ones in your preferred specialty? I think it's September, October, and November are the most, of your fourth year, the most key rotations in for your specialty. Once you figure it out, make sure you're going where you want to go, like in those 3 months, and that would be your best. Anybody else have input on that?
I think
For auditions, yeah.
Yeah, for auditions.
for third year, I would recommend doing, if you think you know what you want to do one not at a residency program, but with a doctor and in that specialty. And then if you like it, schedule at least 1 or 2 your third year at a residency program. That's what I did, and I was able to get a letter from both the program director and the chairman, and from a program that I ended up loving. And so I already have a connection, and you can follow through, keep in touch with them with emails. They already know you. You can go back your fourth year to really show your interest.
Absolutely, I definitely agree with that too. If you can move your electives, if possible, to the end of third year, and try to gain exposure to that specialty earlier on in third year, even if, you know, if you get off of general surgery one day early and you know you're interested in orthopedics, jump in with the ortho guys if possible and get that exposure, so that way you can use an elective month to go to like an ortho program or urology or ENT, whatever it may be. So you kind of want to strategically kind of move your rotations around.
Is there any guidelines on how many times we should rotate in our preferred specialty, or do you want to try to stay broad? Is that something that people look at, or do they just want as much in your specialty as possible?
I think it kind of varies based on specialty, maybe. I'm speaking from an ENT perspective. So with that being said, so for ENT, DO ENT in particular, there's 14 programs with 19 spots. And because there's so few spots, they're very much of the mind of, if you don't rotate there, we're not going to look at you for an interview. So that's why I tried to start in third year doing audition rotations, and then have my whole fourth year set up as well too. And other specialties where there's more spots, they understand you're not going to be able to get to everything, so it may not be quite as important. I mean, it's still important, but maybe not.
I think it's also important to know that you have to really evaluate where you stand as, you know, an individual, and look at your whole, I guess, how competitive you actually are. I mean, we all want to get into these programs, but you also have to be realistic in the sense that it's super competitive. So you don't want to just look through all your eggs in one basket per se right away, which is why I think the third year is really important to try out different specialties. It could be all surgical specialties, but even if you think you're ENT, you might come across something that you really like and enjoy. So I wouldn't cut yourself short in the third year. I would try to get yourself exposed to different types of surgery, but as Zach said, toward the end of that third year, you should really have an idea if you're really going to pursue it, and then that's when you want to start, you know, really putting all of your eggs in one basket, I guess, at that point.
That being said, too, when you schedule your fourth year audition rotations, start scheduling them early in the spring, because they book up fast. You got to realize everyone is booking them up. Is that what you're going to say? Okay.
No, I disagree.
The difficulty is that you need to figure out what you're going to do with the rest of your life right after you get done with, you know, halfway through third year of med school, and you haven't experienced these things yet. So, I mean, in that sense, you want to experience them before you decide on what you want to do. So, you know, you have to kind of balance between, okay, I need to set up, you know, these rotations in my specialty, or just try to get a general, like, experience.
So do you guys recommend doing research in third and fourth year?
Absolutely.
Obviously, but like, how do you balance the research and
the way, I can just personal experience, the way I did it is you find a doctor who does research, and you find one who takes med students, and you talk to him and you say, I'm interested in X and Y, like, you know, how can I get onto a research project? And you talk to them at the beginning of a rotation after maybe you've known them for a few days or up to a week, and you get onto them, or if you've been in the same hospital for a long time, you get to know the doctors, and you'll find that there's just certain physicians that do more research and that take more students, and that's how you get on to research projects.
To just also add to that, what you can do, especially if this is more for first year students going to second year because you have the time, I really would recommend Googling different university hospitals because you can see if they have summer fellowship programs. I personally applied to a summer fellowship at Hospital for Special Surgery in New York, and that was through the internet, through their website, and I know a bunch of other hospitals have this, so it's an actual summer program. Unfortunately, most are 2 months long, so if you don't have 2 electives in a row or a vacation and elective, you might get into trouble, but what I did was I only did it on my vacation month, and I spoke with the doctor and the physicians there, and they were okay with it as long as I worked a couple extra hours and whatnot. So use your vacation as a research month if you can. You know, you want to take some time off, but if you're going into one of these specialties, unfortunately, it's so competitive that you want to use every bit possible to get yourself well known and maybe get published, you know, as an end goal.
And don't underestimate the power of case reports. So even if you have a cool case on one of your rotations, ask the doctor if you can write it up for him, show it to him, and then submit it to even, you know, American College of Physicians always has poster presentations, FOMA, different conferences that are going on that you can submit the abstract to and then present it as a poster. I did that several times, and then I actually got in touch with the program director at USF. You just kind of have to email people to try and find your way in there, and he was happy to have me come on, and he gave me a case report to write up, and you know it's going to be submitted for publication. So case reports are a great way. They're not too time consuming, but they're a great way to get your name published and get experience and show your interest in the field.
Right, so you found a research mentor that basically gave you a project.
Yeah.
And that's excellent. It's the easiest way to do it.
Ideally, I think too, you want to have research within the specialty you're considering, but if you don't, it's not an end-all be-all. You can do it in other stuff. A lot of these places, what I've seen and talked to people is they want to see that you know how to do research, not necessarily that it has to be in, you know, urology, ENT, ortho, whatever it is. Any research you have is going to be better than nothing.
In the military, if you get a publication, that's worth the same points as getting 2 poster presentations. And then also, I was going to add, never mind.
Okay. We'll end that one right there. So transitioning into something that's a little bit more relevant for the first years that are now in a summer break and we have all this free time. What should we be doing right now in our summer to prepare us better for the second year here at LECOM and for our steps?
I think doing anything to kind of bulk up your resume or your CV, like if you don't have any research, you know, try and get out there and try, like Arianna was saying, these research fellowships that are over the summer, you know, the people who are doing the anatomy lab stuff, that's great. Anything that kind of can help you, something unique, something you enjoy doing, you know, have fun too. This is your last kind of break. So enjoy it.
Have fun. Yeah, enjoy that last summer off. Do something worthwhile though. I definitely agree. Either, you know, do volunteer work somewhere, go on a mission trip, do research, get involved with something, especially if you know what you want to get involved with. But I highly recommend relaxing a little bit, you know, study a little bit on the side, but it is your last break for forever. So, you know, enjoy it while you can.
Is there anything specific to studying for the step 1, the boards, that anybody can start now? Or is it, like you said, just relax and give your brain a break and then have it ready for the next challenge?
Yeah, I don't feel like studying like that summer would have really helped. It just, you have to relearn it. I mean, you're not going to retain it, basically. Like, enjoy your summer.
Find out stuff you like. You know, I just started watching House again randomly, and so you know, I would see an episode and I would see something I enjoyed, and you know, I would read up on that, and I was doing it because I enjoyed it. But you know, make it fun.
The only thing I can think that actually would help is if you familiarize yourself with first aid, like in that summer, it might help some. If you look through and say, oh, this is a section on, you know, rheumatology, and this is kind of like what's in there. It wouldn't be a bad idea if you really wanted to.
If you're a true gunner.
Sage advice for the gunners here.
Yeah.
All right, so, okay, now we're going to get a little bit personal with you guys. So what is your personal most embarrassing thing that has happened during your rotations?
I'll start. So I was on my first surgery rotation was actually orthopedic surgery, and I was with the trauma surgeon and did all these kind of fracture repairs. And you'll find when you're in the OR as a third year, you're like, your eyes are just huge and you're just like, don't touch anything, don't get in the way. And you take everything literally. Whatever they say, you interpret it as that's what they mean. And so some kind of things in general is you want to, as a third year med student, before you go into the OR, you want to get your gown and your gloves, go familiarize yourself with the scrub tech, give them your stuff. So anyway, I was doing that. This is about like 6 o'clock at night after we spent all day in the office and he had to repair somebody's hip. Long story short, I bring my stuff to the scrub tech and he's like, I was like, where do you want me to put it? He's like, right here. And I was like, oh, that looks kind of sterile. I was like, where do you want me to put it? He's like, I said put it right here. So I took my gloves and dropped them onto a sterile tray. I was like, that doesn't seem right. I dropped them and he turns around and said, what are you doing? And I was like, you said put them right there. Like, I asked you 2 times. So this is like 6 o'clock at night. Patient's already under anesthesia. And this was the only tray they had for this particular procedure. So they had to flash it in the autoclave, and we delayed the surgery about 45 minutes. And the patient was under it. And all the OR staff is just like, you're next. So I mean, realize it happens to all of us. Stupid things. If someone says that you touch something and you're not sterile for whatever reason, just say, okay, no problem. Either go re-scrub or have them put a sleeve on you, whatever it may be. You just don't want to cause a problem in there. But just try to use some common sense with it. Obviously, that was kind of delayed common sense, but for me, but it happens.
Excellent. All right. So as long as anybody can top that.
I don't think so. I mean, urology.
Okay, so transitioning from that, so what can make you impress an attending a resident above and beyond that most people would overlook?
Offer to do a presentation on your rotation at like their weekly conference or their grand rounds on a topic you're interested in. That's a really good thing to do.
Absolutely.
Especially at residency programs,
Yeah.
because they have students doing it. And some of the programs, I was up north for most of mine, so I did a lot of rotations with PCOM students. And PCOM actually requires them to do these presentations. LECOM, not so much up there. So you really want to do them not only just so that you outshine everybody as well, but just so that you're kind of at the same level as everyone doing what their core requirements are. And for surgery in general, I would definitely, Zach already touched on this, very important though, read up on the procedures ahead of time. Make sure you know what tools they're going to be using, all the different types of equipment they're going to be using, and even if you don't understand it, you can ask them, why are you using this type of equipment versus another thing? Just the fact that you know what they're going to be doing shows that you have read up on it. They don't expect you to know much just because, I mean, especially third year, I think you're at bottom of the barrel, so.
And I think kind of like, in general, frequent themes in surgery that I've noticed when getting pimped in the OR are going to be indications for surgery, contraindications for surgery, and then side effects, like what would happen outside of your general anatomy, that is, of course. So I don't know if there's anything else that you guys have to add to that you've seen in general themes.
I think one other thing is like in the conferences, like the weekly conferences, if you ever hear the attendings like asking a question like, oh, I would be interested to know about this, or I wonder what this is, look up whatever they're asking and then email it to them, because they're really impressed by that. If you just kind of take initiative, answer questions that they may have said in passing, it just shows that you're paying attention and you take that extra step.
And offering to take call, especially with the residents on weekends, I think is a big one, because there may not always be an attending there with you taking call on the weekend, but if you're there with the resident consistently, the residents will report that and say, oh yeah, so-and-so took call with me this weekend and this weekend, but really kind of go above and beyond and express that to the residents too, not even just the attending of the program director. Let them know you're very interested in anything that you can do. If they want you to go see the patient first on the weekend and go pre-round on the patients and then report to them later on, do that. I mean, anything that you can do can really involve with the residents.
Yeah.
All right, changing gears a little bit. Do you guys think it's better to do all internal medicine rotations in your third year for your electives in an effort to do better on your step 2, or at least attempt to do better on your step 2? Or would you rather just plug out what you're going to do and hope you get what you
I've heard that strategy employed before, and I think it's valid as far as, you know, learning medicine, which is of course extremely important. That's what we're here for. But like we were saying before, you have to balance that with trying to rotate in the specialty so you get an in with the crowd.
I think the most important thing in third year is just getting a taste of everything that you're even considering. Any subspecialties of surgery or any specialty in general that you're considering, I would use your electives for those, because this is your only chance to kind of see before you have to make the decision of what you want to do.
I think it's definitely, just one more thing to add to that, it's maybe somewhat situation dependent. You know, if you killed step 1 and you have a great step 1 score, then you want to have a good level 2 score as well too, but if you have a not so great step 1 score, then you need to kill level 2 to show them, hey, I'm making up for it. So in that case, maybe you want to do more medicine, but it also depends on what program or where you're going to go to do your medicine rotations. If it's going to be, you know, US Health Works, you're maybe not going to learn as much as somewhere else or have as much time to study. So you kind of got to balance all that.
So like one other example is that it'll be every rotation essentially is attending dependent. You know, everything's going to be every rotation is going to be different. And so I scheduled a cardiology rotation. I have no interest in cardiology, but I had heard that attending is extremely good, teaches you a lot, and I'm, you know, extremely happy that I did that rotation in cardiology. So you can kind of consider these things as well.
So I heard a rumor that residencies are now weighing step 2 more than step 1. Have you guys found any truth to that, or do you know anything more about it?
I think step 1 kind of gets you through the door or past the, at least a lot of places have cutoffs for USM or COMLEX or USMLE step 1 scores. So, I mean, step 1 is still really important. I think step 2 becomes more important if you don't do that well on step 1. But if you rock step 1, you should still rock step 2 because they're going to expect you to do well on that as well. But I think step 2 means a little more for people who need to kind of boost their application because they didn't do that well in step 1. Do you guys have?
No, I think that's absolutely right. I think you need to just do well on both.
Yeah.
If possible.
You need to do
But
well on
I
both.
think step 2, you can't take it lightly whether you rocked it or not. You do need to do well on it. But I do agree, if you have a little bit lower step 1 and you're looking for a competitive specialty, step 2 can definitely help, you know, with that. They want to see that you can make up for, you know, that you know your stuff. So don't take it lightly, that's for sure.
I did speak with a residency director about this. He said that he would overlook a step 1 score if they killed step 2. So that's basically the same thing you said.
There's websites out there. One on baronrocks.com is one of them. They have he's posted a PDF there where they survey program directors and have them list like the 10 most important things they look in applicants, and it varies specialty to specialty. So where in internal medicine may be more step 2 dependent, score dependent, something else may not be more step 1. So it kind of vary. You know, you got to kind of reach out there and look for those lists to let you know what's going to be most important.
What do you guys recommend doing for your CCD month, that first month in the 4th year that you have off? Do whatever you
Study
want.
for boards.
Study and work on ERAS and your application.
I think they're changing some things though for you from what I was told. I don't know if any of you have heard this or not. I actually was just told this yesterday. I think they're trying to incorporate a CCD month to be that last rotation. That we had a last rotation of 3 weeks long. I think they're now trying to change it into a CCD month, which would be perfect because then you can study during those 3 weeks and have an extra rotation to do an audition in your 4th year. So if that can go through, which for you guys it might, I 100% would say take the 3 weeks, study 100% for the boards, don't worry about auditions, and then start your auditions in your 4th year. Right now we're all taking that time, I believe, to study for boards. I don't know if anyone's doing an audition now, but I 100% will, you know, want to study for my boards. You don't have that much time you have time during 3rd year to study for shelves and whatnot, but you're going to want some good, legitimate board studying time.
And also working on like your personal statement, I would recommend starting that as early as you possibly can. Keep track of like really memorable cases that you've done over your rotations because you can incorporate those into your personal statement and just start as early as you can because you want to send it to as many people as you can and get as much feedback as you possibly can.
And your CV too. So this is something you can do in first year, is start on your CV. So if you have volunteer stuff, you're gonna forget that you did it. Put it on your CV and just build it as you go. Instead of getting into your third year and then you don't have anything done, you have to go back and think, oh, what did I do? When was it? You want exact dates and like responsibilities and everything. So working your CV is something you can start on now. So that's something that's good.
Tell me how important it is, or not important, to take the CE to PE early versus later.
I think you want to take it earlier, as in like early fall. The kind of thing that they're running into, and from talking to, in particular, fourth year I know, is he took it late, and by the time match came around, this program didn't have his PE scores back yet, and so they were like, well, we want you, you're one of our top choices, and we have a spot for you, we don't have your score. Luckily for him, this is for neurosurgery as well. Luckily for him, they held the spot and essentially let him pseudo-scramble into it, so he got lucky, but there have been cases of students losing their match or not being able to match because program directors don't have their PE scores.
Did you say PE or CE?
Either one.
Okay.
Oh, I'm sorry.
I definitely recommend taking CE like before you go out on audition rotations,
absolutely.
because you don't want to be studying and worrying about that when you're out on rotations and you're concentrating on impressing your attendings and the residents. So, like for us, we're all mostly taking it in June before we leave for our rotation starting in July.
So, how bad do you look if you're carrying around a notepad and pencil on rotations?
That's fine.
No, it's
I
fine.
did that the
always do.
entire time.
Yeah. No, I tend to like to ask the physician or the residents who I'm working with ahead of time, just saying, I have my notepad here, I'm going to be writing notes, do you mind? Because, you don't want them to think you're just playing around or doing whatever, especially with the iPhones, they don't know what you're looking up. So sometimes if I was looking something up, I'd say, okay, I'm going to look this up for us, just so that they know I'm not playing on it. But have your notepads out, have, the little ones that you can carry around. You want to have pocket medicine too, that's another one for any rotation. 6 or 8 in your pocket.
And you can have a tablet too. I bought a tablet specifically for rotations. It's a 7-inch tablet. I highly recommend it because it's easy to look things up. You can even, on some hospitals, get onto their hospital program, and you can pull up a chest x-ray of a patient and show it to your attending and say, hey, this is what their chest x-ray looks like. They don't have to go back into some room where they have computers set up to go take a look at their chest x-ray to make sure it's okay. You can do all kinds of stuff with those.
Excellent. So one last thing, I just want to go around the room here and have each of you tell us like one final words of wisdom, one final thing that you guys think we should know, words of encouragement, anything that we can get out of you guys, because we appreciate you guys coming in so much. So.
All right, I guess I'll start. Definitely pick something you love, and like I said earlier, kind of try everything, even things you don't think you would like. I had kind of thought about urology, but until I actually did it, I wasn't confirmed. And then once you finally decide, you do have an advantage if you decide early, so that's the good thing about doing the rotations earlier, because then you can start kind of putting all your efforts into getting research and building your resume to look like like it's centered around that specialty. And then once you get out there, just work hard. You're going to work the hardest you've ever worked, but it's going to be worth it in the end.
I second everything she says. I think one thing I learned is you want to meet as many people as possible, and you want to talk to as many people as possible, because people who are maybe 3rd, 4th year residents, they've been through it. So you want to pick their brains as much as you can. Don't burn any bridges. Also be very grateful to anyone who helps you out, because I've come across many physicians who have taught me so much, and they tend to like to see when people actually appreciate what they're doing for them, because they don't have to take the time to teach you something or take you on for research or even for the rotation. And you never know, who they know and what they can do to help you down the road. So once again, be thankful for that. I think the biggest thing is get along with the residents. You have to just be a happy person. If your board scores aren't great, that's okay, because you have to just make it up elsewhere. And if the residency program likes you, that's really your big thing in. As far as anything else, show up on time, and like I said, I really am pro just they have to like you. So don't think you know it all, because you don't. None of us do. I still know nothing. I feel like every day you're going to go in thinking you don't know anything. So just, be be a human, pretty much.
I would say just kind of everything that you guys said, plus be proactive whenever you can as far as researching your specialty, talk to other people that have matched into the specialty, just like you were saying, contact professional organizations within that specialty, see when their conferences are, see if there's local things going on. Any exposure that you can have is going to benefit you. And then the only other thing is, I would recommend definitely whoever you interact with, whether it's a scrub tech, whether it's a medical assistant in an office, make sure you're friendly to them. Don't act like you're above them or asking them to go get you this, this, and this. Like you got to realize that you have a place as a third or fourth year medical student, and some of these attendings take that into consideration. They talk to their office staff. Okay, well, when he was here, when she was here on a rotation, how do they interact with you? Or even if they're not talking, they're watching the entire time. So you always want to make sure that people are watching all the time. So make sure you're conducting yourself accordingly.
Got it. So I think the biggest thing is whenever you start a rotation, be observant. Try to figure out where you can fit in and where you can contribute. Another big thing, you can bring in cookies for the nurses. It will help. Also, there's always a shortage of pens on the floor. Consider bringing a box of pens and just having it there for them. Also, bonus points and donuts for morning report doesn't hurt. It doesn't necessarily help, but it certainly doesn't hurt. And just like they said, if they like you, they're going to try to get you into their residency. So if they think you're smart enough, if they think they'll want to work with you, if they think you're going to work hard, then they'll want you into their residency. So those are the big things.
Excellent. Well, I honestly can't thank you guys enough for coming in and giving us so much information, way more than I thought we were going to get out of these lame questions I gave you. So, you guys can give yourselves a hand, and we'll definitely be cheering. And thank you guys enough. I can't thank you guys enough. It's just
Good luck.
excellent.
Good luck.
Good luck. Yeah.